Hi everyone, it's Elizabeth Stephenson with New Direction Family Law, where we believe with change comes empowerment. I'm here today with Dr. Schneider, and she is one of our cadre of experts that provides support for clients who are going through separation and divorce, so that they can have the life they want and they deserve. And Dr. Schneider, welcome.
Thank you. Glad to be here.
Good, I'm glad. I sing your praises all the time because she has a practice that is so revolutionary, especially in this day and age. And so we want to spend some time this morning talking about the services that you provide and the creative way that you do that.
Okay.
But first, share with the folks that are watching and that will be watching later on a little bit about yourself and your philosophy and how you came to start this practice.
Okay. I am an internal medicine specialist, and I'm also in training for integrative medicine. And integrative medicine is using the best of complementary and alternative medicine and allopathic medicine. And so pretty much I tend to not want to prescribe too many medications. I counsel patients and listen to them, and that's really, I feel, is one of my best qualities. My practice model is called direct primary care. What it is that we have removed the government and the insurance company from the equation of patient care.
And we're right there. Let's stop right for a second. That's just, that's an amazing ideal, because most of the clients who come to me, once you get divorced, you cannot stay on your spouse's health insurance. And so COBRA is terribly expensive.
Right.
The Affordable Care Act, or whatever comes into being next, is terribly expensive if you want to have a policy or you have a pre-existing condition.
Great.
So how do you help folks that are in that position?
Okay. What we do is we have a membership practice, and it's kind of similar to what you would do in a health club. And so you pay a one-time membership, and then you pay an amount that is half your cable bill every month, and you can receive your health care and a lot of your lab work throughout the year. And we don't mind people who don't have any insurance, because we work with them. If you have catastrophic health insurance, which is probably the cheapest that you can get on the market now, or with group health insurance, and that will be pretty much if something happens, such as a car accident or surgery is needed. And so I provide a complete history and physical to every patient that walks into my door. I get to know them. The appointment is 1 hour. Follow-up appointments are 30 minutes. You have access to me through email, phone, fax, phone calls to the office. After hours, you get me directly. You don't have to go through an answering service, because I forward my phones from the office to my cell phone, so I can help you. I'm even willing to come in on my day off to see you if you're sick, so you won't have to worry about going to urgent care, which will cost a lot of money.
Well, that in itself, I can't tell you when I've ever picked up the phone and talked to my doctor. I love them, but I've never been able to do that. And you say that you're an internist and you're an integrative medicine.
Correct.
And that really focuses on the whole person, not just the health part of it, really, right?
Right. Because of the current practice model that we have, which is the PCP, the primary care physician, the physicians are very limited by health insurance and by Medicare and Medicaid, and they can only maybe spend 7 minutes total with the patients, because they're bound by reviews from the patients, and that's how they get paid.
Right.
It currently is on the quality of care, but in my opinion, the quality of care has decreased considerably in the model that we have now. With direct primary care, I am able to spend more time. As physicians, we have been trained to take care of disease. We can help you take care of a problem you have. However, because of the time limitations, we have not been able to spend as much time with our patients. And so with the current model, I am able to take care of the patient as a whole, which means taking care of them body, mind, and spirit, and do not treat them as a disease process.
And so you really focus on, instead of having them come when something happens, you want to be in a preventative mode and help them
Correct.
in that way, right?
And that's what I have always practiced for the past
love
30
that.
years is preventive medicine, lots of counseling, and being available for the patient.
So tell me, other than like medical services that you provide, what else do you give to clients and patients to help them in that whole sort of wellness?
Okay. Obviously, as you are going through a divorce, it's one of the major stressors, and so you're going to become very stressed, and from stress, inflammation can develop, and a lot of diseases actually originate from inflammation.
Mm-hmm.
So what I focus on is counseling and helping the patients to take care of themselves and to heal themselves. And I do that through body-mind modalities, which will include meditation, which you can either go to somebody to have that done, or I can teach you. And there are lots of apps on your phones that you can download. Another modality would be guided imagery, where the app will have something where someone in the background, along with the music, is talking to you, telling you to relax. We have other modalities such as biofeedback. I don't provide that. I would have to send you to somebody. Acupuncture, chiropractics, massage therapy, yoga, which is mindfulness along with physical activity. So doing all that, and of course I can't accomplish that in one visit.
Right.
And because of my direct primary care practice, where you have unlimited visits, you can see me every week if you want, and I will work with you to help you. So I don't want to say I'm a one-stop shop for medical care, but I can at least provide probably 90% of your medical care without sending you to specialists, which is the costly part if you don't have health insurance or if you only have catastrophic health insurance.
Right, and so you like us, you have sort of a cadre of people you trust that if you can't provide, say, acupuncture or yoga or that, then you know someone that can do that and you trust that person.
Exactly. I have some people that I have talked to, and I have tried to get discounts also.
That's
And
great.
so they're not going to charge you what they would normally charge the health insurance, so they will charge maybe half, or they know that if I'm sending you my patients and I'll be good to you, please be good to my patients,
Right.
and give them the discount.
Right. And so do you, you provide, so as the service for the monthly fee, you provide those wellness visits, they have access to you, right?
Exactly. They have the complete physical, they have unlimited visits, they can call us as many times as they need to. So if they want to come every week, as I said before, they can come every week. We're available, and our appointments are long. They're 30 minutes,
Okay.
and if need be, we'll go longer. I have spent as much as an hour and a half with a patient for a physical. She had 11 medical problems.
Wow.
So I had to outline them all and discuss them with her and make sure that she knew how to take care of herself.
That's great. So do you see this as something that's going to spread? I mean, is this the new wave?
I'm hoping that this is the new way, because Congress they have something they need to vote on, and using healthcare savings to pay for your membership in direct primary care. And a lot of people are tired of the reduction in the quality of care,
Right.
and not having the time with their doctor.
Right.
And I know for a fact is when I go for a physical, I'm healthy, I don't have many problems,
Right.
but it's almost like, hi, how
How
are
are
you?
you?
What's going on? The next thing I know, the doctor is on the computer, and all she wants to do is fill my prescriptions.
Right.
She's a good doctor, and
Right,
I like her.
Right.
I'm not critical of my doctor. I am critical of the way she is forced to practice.
Right.
And I know the same thing for my husband. He's also a physician. He works for a large organization here, and they are required to see so many patients, and up to 25 patients a day. And if you really, and he does spend time with them also, and so he ends up with no lunch, ends up getting behind, and as a risking getting poor reviews, which will affect his pay, but he doesn't care. He's a physician and he is a healthcare provider that wants to help patients, so he just does what he needs to do. And I feel fortunate that having the extra time, I am very happy to be able to contribute to people's wellness.
I love that. And so, you know, we were talking about before when you're going through separation and divorce, and even just raising kids is stressful.
Right.
So, if someone, what can you share with folks to help them reduce and sort of take back their time, their life, and give themselves some relaxation and some restorative sort of things they can do?
As we said earlier, obviously this is a very stressful situation, and it is a loss, and so you're going to be bound. The person is going to be bound to get into a depressive mode, mood swings, things like that. So I highly recommend eating well and stop dieting. Okay. I know if a person is depressed, they don't eat well, and some people will overeat. So it depends. But try to focus on eating a healthy diet and drinking lots of water. That's very important. Start a structured exercise program. Don't get started on your own. Go somewhere to a spa or to a personal trainer to help you do that. And exercise does increase there's serotonin in your brain, and so we call it the happy hormone, so that will help to a certain extent. And I highly recommend mindfulness, and what I mean by mindfulness is what I discussed earlier, biofeedback, stress reduction, mindfulness, guided imagery. And a lot of the hospitals around here, they offer something called MBSR, which is mindfulness-based stress reduction. And it does cost some money, but you go for 8 weeks and you learn these modalities.
So that you can keep doing them
keep doing them. And it's very important to structure yourself. And because you're going to find yourself, trying to raise children as a single parent. You had help to a certain extent before, but now you're doing it all alone. So the most important thing is keep organized, keep structured, and try not to take a big bite out of life. Just cut it into small chunks.
Small chunks, that's what I say,
And you will reduce the stress. The most important thing is we need you to be a healthy person to take care of your children, just like they do in the airplane. When there's a cabin pressure, the oxygen thing drops, they tell you to put it on yourself and take care of your children. So that's very important that you do take care of yourself.
That's right. And if you don't take care of yourself, you can't take care of others that need you.
Exactly, because then you'll end up burning out, and that's not good for you or your family.
Right, and then when you help folks, that helps me help them get through the legal process, because then they're rested, they're mindful, they can focus on what I need them to focus on. So in a way, you help them move through that path and get to the other side too.
Because you need their help to help you help them.
That's exactly right. Exactly.
So we're collaborating.
That's right, exactly. So now you're going to help us with our workshop series for 2017 called For a Better Life, where we focus on health, wealth, wisdom, and love. And you're the health part of that.
Right.
And your workshop is coming up in June. We're the first Saturday in every month. And we're a centralized location in Raleigh, right off I'm old school, the Beltline or 440. We start at 9:30. You can go to our website, New Direction Family Law. Click on For a Better Life and register. We'd love to have you. We want those workshops to be interactive. So when people come to your workshop, do you want them to come with questions?
Questions are fine.
Okay.
Questions are fine. I love answering questions.
Okay.
It's not a problem. As a matter of fact, I probably plan on having just a small presentation.
Okay.
And have them ask questions.
That's fabulous.
Yeah.
Great.
Well, Dr. I don't like slides and things like that. Because I am old school too.
I know.
And I'd rather talk to people, because I'm a very open person, and I love people. I love taking care of patients, and it makes me very happy when I see my patients happy.
You can just tell that. That's why I love you so much. You just exude. You really walk the walk, and what you say you do, You do. So,
Thank you.
how can they get in touch? How can someone get in touch with you, Dr. Schneider, if they want to contact you?
My practice name is Schneider Medical Group, PA, and I have a website, which is www.schneidermedicalgroup.com, and you can register or online, or you can get our phone number and call us, which is 919-301-8971. And we are located in North Raleigh in the Creedmoor Center, which is basically Creedmoor Road and Strickland Road. So that's a very good location for people to come from Cary or from Raleigh, anywhere in Raleigh, or from North Hills. And I welcome everybody.
Yeah, and I do want to say, you're sort of like us. You know, our office is in a home, and we want people to feel comfortable. And when you walk in Dr. Schneider's office, it doesn't feel like a doctor's office. It feels very welcoming and warm, just like she is. So,
Thank you.
So contact Dr. Schneider if you're looking for health care, or you want a new way to do things and a better way to do things that concern your health and your body and your mind and your soul. So thank you for joining us, and we'll see you next time. Thanks.